through Sunday morning. Back to the studio.
All right, thank you, Chuck. 7:35 now. So teenagers, I mean, they'll do just about anything, right, to look like their favorite celebs. You see it on YouTube, these videos here of teens trying to plump their lips looking like Kylie Jenner. So the 17-year-old Jenner finally did reveal that her lips were not natural. She came out saying that she had gotten lip fillers. And we want to, talk about this because there's a chance your teen could ask you about this, or possibly you like the look yourself and you're wondering, is it safe and how does all this work? So Dr. Kevin Smith is with us here from Charlotte Plastic Surgery to discuss. Thanks for coming in.
Well, thanks for having me.
So certainly you could stick your mouth in a bottle like those kids did and have it last temporarily. There are cosmetic ways to do this, and you were saying though the importance here is the important thing to see is that those are so obvious. If people look at you and say, "Did you get lip fillers?" Something went wrong.
Right. I think that good plastic surgery isn't seen, and when done with an artistic hand and an artful eye, it should be something that people notice, but they don't know that you've been injected.
They can't pinpoint it exactly.
They can't pinpoint why it looks good. And I think we really don't understand this new Hollywood new normal because I think it just looks silly. It's obvious. They over-infill, this overinflated look where you've lost lip shape just does not fit a pretty face.
So let's pull up some of the pictures, because you sent us some, and these are people that I have noticed before too, and you look at their faces and you go, clearly it's not natural, but you don't know exactly what they had done. So Lisa Rinna obviously has a very notable lip change here. Meg Ryan too. Now, what are we seeing here in these pictures?
I mean, in these celebrities, certainly the lips are overdone, there is too much volume and loss of lip shape, too much red show, and these lips look more like sausages than really pretty Cupid's bow lips.
Right, and you were saying these could be actual implants, not just
There are implants that are available where small pieces of plastic or Teflon are placed inside the lips. There are injectables, some of which are permanent injectables. But I think now in today's medicine, we're getting away from that. We have so many good fillers, temporary fillers, the hyaluronic acids, that not only are they effective and they last about a year, but they're erasable. If you have a complication, which can occur, or you even don't like the look, we can erase it with an enzyme that we inject and make it go away in 12 hours. So it gives us great control. And for women who are perhaps interested but afraid to make that plunge, they need to realize that it's safe and it can be erased if they don't like it.
And a year is still a significant amount of time. I mean, you're not having to go back all the time to get this, done and redone. So how does this work? If people are interested in doing this, is it an invasive process? It
involves needles.
Okay,
there's an injection of a gel. This is a Juvederm Ultra Plus or Ultra product, and this clear gel is injected with a fine needle into the lips. And this is a natural product. This is something that is well tolerated by the body and has very few complications. But I do want to stress that it's very important to make sure that you're in the hands of a good injector. Nurse injectors do a very good job, but I think it's also important that they are working in the same building with a supervisory physician, because if complications occur, they need to be recognized and treated.
And let's talk about the age here, too, because someone like Kylie Jenner, a lot of people are hearing about this now just because she was making so many headlines for the fact that her lips changed so significantly. She finally said, yes, I had some fillers done. She's 17.
Right.
Is that a safety concern, or is that just sort of a question? You just say it's an individual basis.
This is a societal concern. It's a shame that she's in that culture and celebrity that makes her feel like she needs to do it. She's a pretty woman and doesn't need to have that enhancement. So, that's, I think, a personal family decision. I personally, if she were my 17-year-old daughter, she wouldn't be getting lip injections. However, if a woman of majority, 18 plus, desires it, let me tell you that lip injections is certainly better than a tattoo.
Because it only lasts a year, not a lifetime, right?
That's right.